Metformin is an anti-hyperglycemic drug of biguanide class that is used as first-line treatment for the type 2 diabetes. It is used as monotherapy or as combination therapy with other anti-diabetic drugs in the management of non-insulin dependent diabetes mellitus. Metformin is the only drug available in biguanide class. One more drug was available previously that is called fenformin. However, it was discontinued because of strong association with lactic acidosis. Origin of metformin. Metformin was first described in scientific literature in 1922 by Emil Werner and James Bell. Metformin is a synthetic derivative of Geliga officinalis, also known as French lilac, which is a herbal plant traditionally employed in Europe for diabetes treatment. It was introduced as a medication in France in 1957 and the United States in 1995. Chemistry of metformin. Metformin is a white hygroscopic crystalline powder with a bitter taste. Chemically, it is 1,1-dimethyl biguanide hydrochloride. This small molecule is soluble in water and 95% alcohol. On the other hand, it is practically insoluble in ether or chloroform. Let's discuss the pharmacokinetics of metformin. Metformin is well absorbed from the GIT when given orally with a bioavailability of 40 to 60%. Metformin is readily distributed from GIT. It does not bind to plasma proteins. It is not well metabolized and no metabolites are formed. It doesn't undergo liver metabolism. Metformin is excreted unchanged in the urine. However, elimination can be prolonged in patients with renal impairment. Starting the pharmacodynamics of metformin, now let's have a look on general effects of metformin. Metformin reduces hepatic production of glucose, decreases the intestinal absorption of glucose, enhances insulin sensitivity by increasing both peripheral glucose uptake and utilization. Now let's discuss the mechanism of action of metformin. Metformin lowers the blood glucose level in different ways. After ingestion, being absorbed in the bloodstream, metformin is transported to the liver by blood, and then from the blood, organic cation transporter are responsible for the uptake of metformin into the hepatocytes. As this drug is positively charged, it accumulates in the cells and in the mitochondria because of membrane potential across plasma membrane. Metformin inhibits mitochondrial complex 1, preventing the production of mitochondrial ATP and leading to increased cytoplasmic ADP-ATP ratio and AMP-ATP ratios. These changes activates AMP-activated protein kinase enzyme. This AMPK enzyme can also be activated by lysosomal mechanism. By continuing this mechanism, the increased ratios of AMP-ATP and ADP-ATP also inhibit fructose 1,6-bisphosphate enzyme and adenyl late cyclase and decreasing the production of cyclic adenosine monophosphate. Fructose 1,6-bisphosphate activates gluconeogenic enzymes. Therefore, inhibiting this enzyme means there is no continuing of processed gluconeogenesis. On the other hand, adenylate cyclase converts ATP into cyclic adenosine monophosphate enzyme. This CAMP stimulates gluconeogenesis and glycogenolysis. Therefore, inhibiting adenylate cyclase enzyme, no cyclic adenosine monophosphate is produced and there is no stimulation of gluconeogenesis process and glycogenolysis process. Now the activated AMPK phosphorylates into isoforms of acetyl-CoA carboxylase. ACC1 in muscle and adipose tissue inhibit the fatty acid synthesis and promote fatty acid oxidation by reducing the production of malonyl-CoA, which is precursor of fatty acid synthesis. ACC2 in liver inhibit fatty acid synthesis and reduces the hepatic liver lipid stores. All these causes increasing liver sensitivity to insulin and enhances the insulin response to glucose. Metformin also reduces the blood glucose level in the intestine by increasing the aerobic glucose metabolism in enterocytes, leading to decreased or reduced net glucose uptake and delivering the lactate to the liver. The third mechanism that metformin adopts is the inhibition of gluconeogenesis process. Metformin in the liver inhibits the gluconeogenesis process by inhibiting the different enzymes that are required for the process of gluconeogenesis. In this way, metformin maintains or reduces the blood glucose level. Common side effects of metformin include headache, muscle cramp, muscle pain, GIT issues, for example, nausea, vomiting, diarrhea, anorexia. Long term use of metformin can cause toxic conditions, for example, vitamin B12 deficiency, renal impairment, and hypoglycemic conditions. Major side effect of metformin is lactic acidosis. Lactic acidosis is most commonly occurs in patients with renal impairment. Some common brands that are available in market are Metformin by Gats Pharma, Glucophage by Martindo, Glyceran by Firosan Laboratories, Glyciphage by Sun Pharma.